state lawmakers keeping busy at the Capitol. A plan to fund Medicaid. It passes both the House and Senate. A final vote is expected next week. And this is a big deal for a big reason. The program was set to run out of money next month, and that would have left millions of North Carolinians without any coverage. But there are some new rules and some new measures baked into this new plan that some lawmakers aren't so sure about. WRAL state government reporter Caroline Jaffe has the story.
A Republican legislative proposal advanced today, giving Governor Josh Stein and Democrats what they've been pushing for, which is $319 million for Medicaid funding. The bill would give the state's Medicaid program exactly what it needs to keep from going broke next month.
We've always said and knew that eventually we would have to give more funds to it. So I think that this is sort of just the status quo of what we've done in the past.
Republican lawmakers added several provisions that divided some Democrats. Representative Pricey Harrison said she disagreed with background checks tied to the program and funds for an audit into the program. Republican leaders say those measures are necessary to crack down on fraud and waste.
Our caucus was fully supportive of the governor and the agency, and I feel somewhat guilty that I wasn't more supportive of that, but I just couldn't swallow the bad stuff with the good this time.
This was a good start in some of the portions of the bill that deal with getting our hands around waste, fraud, and abuse, and just prices that are getting out of control.
Governor Josh Stein will have to decide whether he's going to sign the bill if it reaches his desk after an expected vote happens next week. I reached out to his office, and he has not taken a public stance just yet. Caroline Jaffe, WRAL News, Raleigh.
Okay. All right. So thank you to Caroline, first of all. Now, before everybody takes a victory lap here about this deal on Medicaid, you should know the story is not over. It's not even close to being over. You see, there are some major federal changes coming to Medicaid a little later this year. On October 1st, eligibility will change for certain immigrants, refugees, people granted asylum. They will be denied coverage. Then in December, things change for people who benefited from the Medicaid expansion. You see, right now, eligibility is checked every year. On December 31st, low-income adults benefiting from Medicaid expansion must get their eligibility checked every 6 months. So twice a year, not every year. Plus, they must prove that they work at least 80 hours per month. Seniors and children, we should mention, will be exempt from this new timing requirement. All of those changes come from H.R. 1, also more famously known as the One Big Beautiful Bill. And it means a big chunk of people using Medicaid today might not have access to it this time next year. Ashley Rowe asked North Carolina's health secretary about this.
How can you assure people who are on Medicaid, as you said, 1 in 4, that the expansion will stay in North Carolina, that they will still get their Medicaid coverage?
Yeah. This, again, is an area of common understanding with all the stakeholders, whether it's beneficiaries, this agency, General Assembly. We all appreciate the importance of Medicaid expansion. So some of the things that H.R. 1 requires us to do around work requirements and so forth, as early as July, when the law was passed, we were starting to think about what does the agency need to do to ensure that we don't put the 725,000 individuals who now have Medicaid services through expansion at risk.
And how do you do that?
Part of it is to make sure we fully understand what the law requires of us, communicating consistently as we've done with stakeholders, working with our counties. In North Carolina, so much of that work happens at the county level, so we've been working very closely at the county level, understanding where we may have some gaps and risks and finding what we can do to close those. So it's been a lot of work. I'm not gonna sugarcoat it and say we're just rolling into it. It's been a lot of work, but we're gonna do everything we can to ensure that those individuals who have coverage through expansion are able to keep it.
And Ashley also pressed Dr. Sangvi on waste, fraud, and abuse in Medicaid. You can find their full conversation over on the WRAL YouTube page. Just get on there and search Medicaid.